This is Stephen Carter with Texas Cannabis Report. I'm here today with Michael Barefoot with the Janice Michaels Foundation. His organization provides assistance to families in Texas who suffer from several diseases, and they promote the use of cannabis as a medicine. Am I correct on that?
Yes, we do. We very much envision someday when cannabis would be considered a mainstream medication, as with anything else. Another big part that we strongly believe in is that no one should be being denied medication based solely on the fact that you don't have a resource. We'd like to see that changed.
What can you tell us about your organization? Is it a nonprofit?
Yeah, we are a 501c3. We are a fully incorporated charity. Have our tax status with the state and the feds. We've been good, compliant group with everything the government's asked us to do. And I guess in some ways we're now asking the government to step up and do their part.
And what specifically does your organization do?
We basically have three areas that we focus on. We have what we call our ERS approach that we try to work with. And the first is education. Our education involves everything from working with physicians who might want to use cannabis-based medications, but quite frankly, we don't teach that in our medical and nursing schools. So we're kind of having to come after the fact to now present that information and help them learn. The other thing that we do is help physicians that are just learning find and connect with other physicians who already are practicing with cannabis-based medications so that they can have a colleague to work with and to sound off and to better learn. The R for us represents resources, and that's probably 90% of what we do right now is resources. Within our ERS approach, the R for the resources is probably the largest single function that we have. And resources for us have been involved everything from helping families get to Colorado to find specialists that can sit down and consult with them and let them know if this is even an appropriate way for them to go. We recently helped a family go up to Oregon, where we were able to locate a specialist that was willing to work with the family. The one thing that people do need to realize is that because cannabis is still a Schedule I, and I do disagree with that classification, we do not purchase medications of any type, whether they be cannabis-based or otherwise. But families need help beyond securing medication. For instance, with our new Compassionate Care Act that's coming up, a lot of people haven't stopped to realize that these families are going to have to come up with money, cash out of their pockets, to have these double opinions. We still don't know what the physicians are going to come up with as to what test, what they want. And I assure you they'll have to be paid for. Somebody's going to have to pay for it. Then, for those families that are lucky enough to be approved to use a cannabis medication, they then have to pay for it. The problem is a lot of these families have spent every penny, every dime that they have trying to keep this child alive, trying to keep this family member out of pain. And now our solution in Texas is pay even more for your health care, and we might let you have the medication. I don't find that fair. And even if it was fair, they still don't have the money. We have patients that have approached us in chronic pain and have sat down with them, and they have tried everything. They are making their doctor's appointments. They are taking their medications. They're doing their spinal injections. And quite frankly, it's not working. And they're watching their quality of life deteriorate to incredibly low points. Those are the kinds of families that we often are able to take by the hand, help educate them as to what cannabis can do and what it can't do. And then help them find a suitable practitioner that can then help them make that decision.
So how are you able to provide these resources to these families?
we have three ways that we raise our funds. One is we do look for corporate sponsors, companies primarily within the cannabis community that realize that we don't have a social services department. We don't have an insurance company. We don't have anybody looking out for us. So we're pretty well on our own. And we go to a lot of the companies that, and we find that they are willing to help. We also rely on private donors that are willing to make a monthly commitment, maybe a one-time donation. I normally don't talk about this part, but 90% of our money comes from Janice and Michael. They are our angels. They are always there when we need an airplane ticket, when we've got somebody who can't make their rent that month. We have someone pass away, and something as simple as getting an urn. Janice and Michael are the ones we can usually always turn to. And that's part of what we need to work on, is taking some of that burden off of them, and as a community for us to handle it versus two people being the guardians. And believe me, they both enjoy doing what they do. They've never once complained. They've never indicated anything else but love for everyone. But the burden of those needing help has outgrown what two angels can provide to us.
So how did you find yourself involved in this organization?
Well, what got me to this point is I was and still am a registered nurse with the state. And I worked with a lot of the programs that took care of home-based health care, children on ventilators, people in long-term care situations. And it would break my heart to go and see a child, see the seizures, see the things that were going on, see the medications we were trying to use, and then I might not see that child for 2 or 3 years, and then rotate back, and the child's name come up again for a visit. And it was heartbreaking to me to see this child that was struggling, but still could make eye contact. You still knew there was somebody there. There was a little hand to hold. And to come back, cry. I'm going to break down and cry. And to come back 2 or 3 years later, and my expression was always that they're gone. They're somewhere buried under the haze. And my question was always, is this really the best we can do? This is it? And the answer is, for our current medical practice, yeah, that's it. More seizures you have, the further we bury you under the meds into a family. Not only do we shut the seizure off, we shut the person off. And I couldn't handle that. That always killed me. I saw it with our vets. I would go, since I live in Central Texas, I used to be one of the nurses that got sent to Fort Hood to check on family members that may be receiving services. And during those visits, I would get to meet the soldier and talk with them and hear their stories. And again, the thing that kept coming to mind is, this is really the best we can do? This is it? I mean, we've got major pharmaceutical, we've got major teaching institutions, we research, we do all these wonderful things. And in the end of the day, that's the best we can do. And yet, we totally reject the idea that a plant might have something to do with health. But we can't allow for that. So I eventually retired from the state, and that was one of the things that we sat down and began looking at is this really the best we can do? And that was a part of the birthing of Janice Michaels, was that, I guess I say this a little bit tongue-in-cheek, but a social service agency for a budding industry.
I'm sure a great many people appreciate what you and your foundation do. How would they go about getting more information about it?
It's real simple. One, walk up and talk to me. I'm always happy to talk Janice Michaels. Also, with www.myjmf.org is where you find our website. And, of course, we're on Facebook under Janice Michaels Foundation also. We have individuals that help us, such as Dan Villanueva. Scott LaRock has also been a very nice, very strong supporter of us. I thank those two gentlemen more than you can realize. Actually, I thank you. I appreciate you helping us get the word out. I think the biggest thing that I can tell people is that, especially as a community, we are able to care for our own, and we can do the right thing. Most of us come from very altruistic backgrounds in the cannabis community. We believe in a lot of the same things, and we do have a group of us that are struggling. And I believe through Janice Michaels Foundation, we can meet the needs of our own